And all right. So hopefully everyone can see my screen. Usual, if you're now at the schools or the health department, we'll ask you to jump off the call and watch for it to be posted on our website. Any information that you need to get down to other people in your school staff, please do so. Just looking ahead, just some reminders with the holidays coming up. We will not meet next Thursday, Thanksgiving. So I would rather be doing other things next Thursday. I'm sure you would too. And then looking ahead, I don't plan to hold a meeting on the 23rd. And then also on December 30th, I figure most of you will be on break. And if we need to schedule other meetings because of important issues, we'll just play it by ear. If you have questions though, feel free to contact me or anybody else at the health department. So I just wanted to start letting you know that so you can make sure and mark your calendars. This is really busy, but it's more just an FYI. We're going to be sending out a letter with the materials this week that you can choose to send out to your staff and your families if you would like to. I think it was a couple weeks ago, I had passed on some information on a couple of studies that are taking place where free at-home testing materials are sent to people. This is just a letter that one of my colleagues had put together and shared that can be sent again to families or to your staff, just explaining those studies and encouraging them to participate if they're interested and giving them that information. So I just wanted to share it with you again so that if you wanted to pass that along, it is on our letterhead, it is signed by me, so it's coming from us. But I just wanted to let you know why you're receiving that and what that's all about. I just wanted to let you know too, some of you I'm sure have heard about this. Some of you I'm sure have kids at U of M, but there is an ongoing large outbreak of influenza at U of M within Ann Arbor, but the majority of cases are in U of M students. When I checked, there's well over 600 cases total in Washtenaw County, but well over 500 that are in the U of M population alone. A lot of the cases have occurred just within the last couple of weeks. And these are lab confirmed cases. So just like with COVID, certainly there are more cases out there that just haven't been diagnosed or that, didn't feel that bad, so they stayed home. 77% of the cases are unvaccinated. The CDC has actually been called in because this is such a large outbreak, especially so early. I mean, it's relatively early in the season, but because there was not really much flu activity last year, they're using this as a good opportunity to see how effective the flu vaccine seems to be working. Because, developing the flu vaccine this year was a bit of a best guess, just because we didn't have a lot of circulating virus last year to base it off of. So there is a lot of research and investigation going on down there. But there is concern because those students will be going home really soon or traveling on vacations because of the holiday. So just a reminder for all of us, if you haven't gotten your flu shot, get your flu shot. If you have kids that are at U of M, they'll be coming home, keep that in mind. The report had mentioned that we're about 25% lower in our vaccinations for flu right now than we were about this time last year. This is a graphic that the state put out just recently, just a reminder that we can get our COVID and flu vaccines together. So as we need boosters or are starting our series, especially in our kids, those things can be given at the same time. I actually got was busy and, put it off like a lot of us do, but I got my flu vaccine and my booster on Friday and did just fine with that. So just as an FYI. Last week I shared this graphic, which is from the weekly flu report, but it gives some activity on other respiratory viruses. The one on the right is the graphic from last week, just to give you some comparison. The one on the left is from this week. So just to show you that in the central region, we're seeing some sporadic influenza A activity, which was not there last week. Looking at, I did pull reported cases from our disease reporting system, and individual cases of flu are not necessarily reportable unless there's some issue, but I did see quite a few cases for Isabella County that had been reported, much more so than any of the other counties that might be on this phone call. And then with our northern region, things are pretty similar, but again, we don't have a whole lot of, we only have one lab in the entire northern region that is reporting. And as you can see, that's all of the Upper Peninsula and the upper part of the Lower Peninsula. So I don't expect their data is the best. I pulled this today and I forgot to put the date on there, but it's as of the 15th. So it's as of Monday. These are the percent of 5 to 11-year-olds that have started their vaccination series in our counties. The red line is the percentage for the entire state. So the entire state is averaging about 8%. We have 2 counties that are higher than the state percent. We have a couple counties, Mason and Manistee, that are close, but the rest of our counties are not even or about half of what the state average is or lower. So, you know, kind of like the rest of our vaccination rates, it is something we do struggle with in a lot of our counties. But I did want to share that because I know a lot of you had interest in how that is going in our area. And certainly the vaccine is available at our facilities, at pharmacies, and at many healthcare providers' offices. This is really busy too. This is some information that should have been sent to all of you, and if not, I just wanted to provide it. But just some resources for schools. If you wanted to have like a school-based vaccination clinic, kind of gives you some best practices, talks about how to set those up with either pharmacies or with your local health department. And then they provided a lot of links and resources. A lot of this, many of you probably know, because I know a lot of you have worked with us already to have in-school vaccination clinics, but I did just want to make sure that you had all seen this information. Some other resources, the NEA actually has a lot of really good information on advocating vaccinations in your population. And then also, I know one big battle we're all dealing with is just fighting a lot of misinformation about vaccines and COVID in general. And the Surgeon General has recently been taking it on as you know, something to address, and has put together a good toolkit on how to address those issues as well. So late yesterday, the governor did put out a press release stating that she encourages that everyone above 18 get a booster. So with Johnson & Johnson, everyone 2 months and out is already recommended to get a booster. So this would be for the mRNA vaccines. But she says as soon as the FDA approval is granted. Then later on in the article, it does say that everyone over 18 should get their booster. I'm kind of reading that to say, and we've already really had basically a very low threshold for accepting people for boosters. We really don't require any proof of health issues or anything like that. So there have been other states who have gone kind of ahead of schedule in opening up boosters to their population. As we'll talk in a minute, Michigan is really doing kind of the worst in the nation right now. And so there has been some push for us to expedite that. So you may hear some news about this, but if you have people that are interested in boosters who don't really have an indication, there shouldn't really be much resistance to it at this point. So this is the same slide as was in our talk last week, just some reminders as to how to schedule or find vaccines. Really the easiest and best one is just to go to vaccines.gov or call 211, and an individual on that line can help you find a vaccine provider. Just like 211 is a great resource to help people find lots of different resources. I just threw these up here. District 10 has put together several different community testing clinics. Right now they're up and running in Mecosta County, Newaygo County, and Kalkaska County, and they're regularly occurring clinics. And I know Kevin, our health officer, is working to get some others up and going. If you look at our data, most of our counties have present positivity that's well above the state average. And that's really concerning when most of, a quarter of the people you're testing are positive. That's a big concern that we're not testing enough people, and we're missing positive cases. So the other is, if you're trying to do a test to stay program or you have close contacts should be tested. I know it's really hard to find testing anymore, or at least rapid testing. So these are just some additional resources for you. The other thing to remind you of, this community testing site is still available. These have sites like I just showed you, as well as any other temporary or permanent sites that are set up for rapid testing. It is a pain to find. You have to go into the K through 12 section of the resources on the state website and then go to the bottom of the page, and it has a community testing link at the bottom. This is the full website here, but this also shows you where there are rapid testing sites up in your community. So I know in my area, like the rest area in Clare is a godsend to have, because it can be, a go-to for rapid testing any day of the week. So again, for data, I would direct you to the mystartmap.info to check out your area. Looking at our school-age kids for the 19 counties, we did see a jump this week, just like we've seen in all age groups this past week. As you'll see, this bottom curve, the orange line, that's from last year. And as you recall, this is when we started to see that winter surge. So you'll start to see that orange line going up in our counties. So I'll run through each county individually. As you probably remember, the y-axis or the vertical axis is different for each county. Some are much higher than others, so just as an FYI. So for Central Michigan District, this is Aranac County, Clare County, Gladwin County, Isabella County, Osceola County, Roscommon County, and then for Mid-Michigan District, we have Clinton County, Gratiot County, and Montcalm County. For District 10, we have Crawford County, Lake, Kalkaska, Manistee, Mason, Mecosta, Missaukee, Newaygo, Oceana, Wexford, and that's all of that data there. Going through the info that was shared this week from the state in their data and modeling report, all of Michigan is still in high transmission. The percent positivity, which had been decreasing, has bumped up again to about 16.5%. The case rate, which was starting to go down, has now been increasing for the last couple of weeks. Our total number of cases over the last week have exceeded every other state in the United States. Last week we were number 2 behind California. The cases in our kids under the age of 12 have gone up by 26%. The percent of inpatient beds occupied by people with COVID has been increasing for the last 17 weeks. The inpatient census for children increased 33% from last week. The death rate did go down just a smidge from last week. There were 280 deaths from COVID during the reporting week for this report. So this just, I included this in here, which shows surrounding states, but also several different countries. The United States, it's kind of hard to see, but the United States is this down here where we had this surge recently and we've kind of plateaued off. Just to illustrate how several other countries are now experiencing another surge. I know that's not what we want to hear, but hopefully we have had our surge and are not going to have another one. But I just wanted to make people aware of what's happening in Europe right now. In terms of the Midwest, Michigan is right here. So we had a little bit of a dip and have bumped back up. So it looks like we're kind of tied with Wisconsin for second behind Minnesota. Minnesota recently has had quite a dramatic increase. So again, everywhere in Michigan has high transmission. We've had a pretty dramatic increase recently. Inpatient bed use keeps going up. Our deaths, again, may be going down a bit. Case rates, though, and test positivity have been going up again. By age, we still have the highest number of cases in the 10 to 19-year-old age group. So followed by the 30 to 39-year-olds. So the 20 to 29-year age group saw the largest 1 week growth this past week. So they are trying to catch up here for third place. So not great. This is that comparison of last year to this year. We're still kind of following along that holiday spike, although hopefully we keep trying to level off. So hopefully that will happen. It'll be interesting to see what happens after the holidays. Unfortunately, those kinds of gatherings tend to be a trigger. So our ER visits, 7.5% of all ER visits are due to diagnosed COVID, which is pretty significant. Our hospitalization rates have been rising dramatically from COVID. Our ICU use from COVID is quite high. Just to note over here, the occupancy in our ICUs is very high. Region 6, which is this little orange chunk here and includes many of our counties, has 83% of their ICU beds occupied. As you can see, we have other regions like Region 3 is 91%, Region 1 is 93%. So pretty full ICUs. Region 6, 41% of their ICUs are taken up by COVID patients. So this just gives you an idea. You know, our inpatient hospital census is where it was last spring right now. It's not as many COVID patients, but we have more non-COVID inpatients. People that have tried to put off other health issues because of COVID are now really sick and needing emergent and hospital care. And this is from discussions with hospital leaders and reading articles from hospital leaders. that's one issue. People that have had COVID now have complications like liver failure or kidney failure, lung complications, heart complications that are causing readmissions. So they're just really overloaded and taxed right now. The pediatric hospitalizations have really spiked over the last week or two, nearly where they were back in the spring surge. We've especially continued to see a lot of hospitalizations in Region 6, which again include Kent County and Muskegon County. So we're still trying to find ways to get a better differential of what county kids are being hospitalized from. In terms of outbreaks, as a reminder, we had one less reporting day for most schools this week because of the deer holiday on Monday. Well, actually, no, it was because of Veterans Day, because this is a week behind. So it was actually because of Veterans Day. I apologize. So it was one less reporting day for a lot of places, but not for everybody. There was some increase, 86 new outbreaks and clusters reported from schools. And I will just go right to the graph because I think that shows it a bit better. So our week-to-week total number of outbreaks each week coming from schools is pretty stable. Again, those ongoing outbreaks just kind of continuously keep adding, and same with the cases associated with them. So the breakthrough cases do seem to continue to increase as we see that waning immunity from vaccines that were given back in January, February, as well as just the extremely contagious nature of the Delta variant and lack of mask use and other preventative measures. Still, though, of those who are fully vaccinated, 1.54% of them go on to develop COVID based on the numbers that we have of those who are getting tested. Certainly there are people who get sick that we just never know about, but based on the numbers we have in Michigan, and the majority of people that die or are hospitalized are not vaccinated. But still, there is more and more argument for boosters for everybody at this point. Just some guidance on celebrating the holidays. So if you wanted some literature to send home to parents or anything like that, there are some links here that you can send. It's essentially same kind of things that we recommended last year. Really nothing is different, although it's gotten harder to really promote those types of things, but just some resources here for you. So again, just a reminder for anyone who joined late, we will not have a meeting next week. And then the week before and the week after Christmas, we will not have a meeting either unless needed. So that ends my discussion for today. We will stop and open it up for questions. All right, let me get to the questions. So if you do have questions, add them into the chat, and at the end we'll open it up to phone calls if people aren't on the computer. So the first one is, with the holidays coming up and with the cases already being higher, would you recommend going virtual for the week following Thanksgiving to help with exposure? So we did that. We had questions about that last year, and in hindsight, we really had found that if schools had done that, it really wouldn't have made much difference. We have really left that to the discretion of the school. However, my feeling is to, rather than preemptively close, to close if you need to. I'd rather keep kids in school, and if you're starting to see uncontrolled spread, or if you're starting to see absences that exceed your ability to teach, then close. But, one concern I have, if you do close, is people just take longer vacations and have more and more exposures. Kids get together more often with their friends, and it just actually could worsen the situation. And you may not have needed to do that, and then you just
sounds good.
Keep kids out of school longer. So the next question, referring to slide 6, it seems that COVID took precedence over influenza last year. Could that be why the cases are more this year? So it is a bit early to say. I think last year we had a really big push for influenza vaccine. In fact, we had pretty good vaccination levels because we were so worried about having a double pandemic or epidemic, and our masking requirements were in place. We had, at times we had lockdowns and restaurant restrictions and different things because of COVID. And anything that prevents COVID from spreading is going to prevent influenza and any other respiratory illness from spreading. So this year, again, we're lower on our vaccinations for flu than we were this time last year. At least the population I see, there's really no consideration, very little consideration for mask use, for distancing, for not gathering in groups, for not going out, things like that. So I think we're just back to normal, which will then see normal influenza activity and transmission. It could potentially be worse because we skipped a year and because we may not have the best match for our flu vaccine, but we're going to have to wait and see. We've only had just that sporadic activity. We've had, the one larger outbreak at the school, but it's just getting started now. So it'll take some time to see what it's really going to be like. But because of all those things, I really do expect it's going to be much worse than last year for sure. But that's because we're kind of back to a normal flu year. Where is a good spot for obtaining additional droplet solutions for the Binax rapid test kits provided from MDHHS? There doesn't seem to be enough for the full box. And MDHHS's response has been that they will not provide more. I don't have a good answer for that. My only thought would be to contact the company and see if you can purchase it independently. But other than that, if MDHHS says that they don't have more, that is the only thing I would know of, would be to purchase it through Abbott. Because I don't think that we have any extra. It looks like Penny has interest in that as well, but if there's anyone on the call that does know where to get that at, you can type it in or chime in. But other than contacting Abbott and ordering it, I don't know.
Thank you, Dr. Morse. This is Penny. I think everybody on this call has gotten those letters from MDHHS about us making sure that we're accounting for all of the tests that we use, or they're not going to send us anymore. But then without those drops, we're going to wind up with, boxes of tests that we can't account for because we can't even use them. So if anybody finds a source for buying those droplets, I would love to have that information shared with the group. I would very much appreciate that from my local districts as well.
So there should be more than enough provided in the kits, but we all know that sometimes they just kind of walk away or disappear from the kits. But yeah, I would encourage you to contact Abbott and ask them if there's a way you can order a bottle, or, kind of give them a sob story that you're a poor, desperate school, and if there's a way you can get extra somehow. But if we find out anything, we'll let you know. Any conversations on quarantining vaccinated people if there's a positive case within the home? Consistently seeing vaccinated members of the same household test positive. No, there has not been. but I can take that to our epi team and just see if they're seeing any trends like that, and if they've heard anything from the national partners and even the world partners, if they're noticing trends like that, and if there might be changes in recommendations. The other thing you can do in the interim is you can enforce a mask for 10 days policy regardless of vaccination status after an exposure, or make sure, do basically like a test to stay, or require a test after 3 days of exposure or something like that. I know that gets tricky when that's not an official guideline, but I will look into that and see if I can find anything. Okay. And I guess the other thing too would be to make sure and confirm that they truly are vaccinated, which I'm sure you probably are, but just to make sure that they are, and that's not the issue. Is there any data on breakthrough cases for those who have had a booster dose? Not yet. Obviously, the data that approved the booster shot did find that there was better immunity, those kinds of things, but the data that we have is that it improves your immunity. So I can't really give you specific statistics because it is such a new thing in the state. I did know of one situation in one of our counties, but the individual had a medical condition which would have caused their immune system to be pretty non-existent. And that is a lot of the cases that we're finding, people having breakthrough cases where they do poorly. They have something really wrong with them, but it's hard to really communicate that through some of these data tables. Is there a waiting period for getting a booster if you've had a breakthrough COVID infection? The only real waiting period is just to make sure you're out of isolation. So 10 days from onset of symptoms, or diagnosis, test date if you don't have symptoms. Otherwise, you just want to make sure you're feeling better, but there really is no waiting period. I have contacted the company and they have sent more, no charge. Oh, so Tanya from Shepherd is our hero. So contact Abbott, let them know that you need more testing liquid, and they should send it to you. That should answer that question. So great. Any other questions? So again, we will send you that letter that explains to families and your staff that, we know it's hard to find testing, and screening testing can help keep things safe. And it gives the contact info and resources for them to look into those research studies where they get free home tests mailed to them. And then it also encourages them that if they do test positive, to notify the school. And then depending on which health department, it tells them how to notify us or their primary care provider or things if they're positive. So, I'd encourage you to send that out to your families. You might get a few that decide to do it, and that's better than none, I guess. All right. Well, if there's no other questions, I think I'll stop talking for a second in case someone wants to unmute. If you've recently had the Pfizer booster and do a rapid test, will the test show a positive result? No. There is no way any of the current vaccines can cause a positive diagnostic test. It'll make you have antibodies. So if you were to get an antibody test, you could have a positive antibody test, but even then they test for different antibodies so they can tell if it's from vaccination or from actual illness. But no, it's clinically impossible. All right. Yep. So I will check on the close contacts and quarantine after vaccination, and we will send you all this information probably tomorrow or Monday once we have it all put together. And you guys have a great Thanksgiving. Stay healthy and safe. And if you have questions or anything between now and our next call 2 weeks from now, let us know. Thanks so much.